with Dr. Vikram Barua Kaushik. He has done he's a well-known urologist. He has done his MS in general surgery and DNB in urology and urinary surgery. Plus, he has done from UK also, FRCS UK also. डॉक्टर साहब एक जनरल आपसे ये जानना चाहते थे कि नॉर्मली लोगों को प्रॉब्लम होती है यूरोलॉजी से रिलेटेड ही रहता है कि कई लोगों को मैंने देखा है कि फ्रीक्वेंसी ऑफ यूरिनेशन बहुत ज़्यादा होती है, कई लोगों में कम होती है। तो इज इट रिलेटेड टू एनीथिंग टू डू विद प्रोस्टेट और यूरिनरी से प्रॉब्लम है, मे बी किडनी में स्टोन है या पानी ज़्यादा पीते हैं या क्या है, तो क्या रीजंस हो सकते हैं?
यूरिन का फ्रीक्वेंसी बड़ा ज़्यादा होने का बहुत सारे कारण हो सकता है।
ओके,
डायबिटिक पेशेंट्स में भी होता है, जिनको
Right.
रात को बहुत प्यास लगता है, बार बार यूरिन के लिए जाते हैं। एल्डरली जेंटलमैन में प्रोस्टेट के कारण से होते हैं।
राइट,
इसके अलावा अगर यूरिन में इन्फेक्शन है, ब्लैडर में स्टोन है या ब्लैडर में कैंसर है, तभी भी फ्रीक्वेंसी बढ़ सकता है।
Okay.
बहुत सारे कारण से हो सकता है।
Okay.
स्ट्रक्चर यूरेथ्रा अगर है तभी भी बन सकते हैं यूरिन फ्रीक्वेंसी, क्योंकि एक ही बार में खाली नहीं होता है, इसलिए बार बार यूरिन के लिए जाना पड़ता है।
राइट,
बहुत सारे कारण हो सकते हैं।
तो उसके लिए बेसिकली क्या टेस्ट कराने चाहिए, मतलब
वो एक बार पेशेंट यूरोलॉजिस्ट के पास जाए,
ओके,
वो एग्जामिन करे, थोड़ा फिजिकल एग्जामिनेशन करे, यूरिन का टेस्ट करे, ग्लूटीन यूरिन कल्चर, ब्लड शुगर चेक हो जाए। इसके अलावा स्पेसिफिक यूरोलॉजिकल टेस्ट अगर बोला जाए तो एक अल्ट्रासाउंड होना चाहिए,
राइट,
फिर एक यूरोफ्लोमेट्री करते हैं,
ओके,
और एक ब्लैडर स्कैन होता है जिसमें यूरिन पास करने के बाद कितना यूरिन रुक जाता है अंदर, वो देखते हैं।
पर जो अल्ट्रासाउंड करते हैं उसमें भी आता है ना कि बैलेंस
उसमें
कितना
कभी कभी
है?
आ जाते, कभी कभी नहीं आता है। अगर अल्ट्रासाउंड
Okay.
होल एब्डोमेन कराते हैं
हाँ,
तो उसमें कभी कभी रेडियोलॉजिस्ट करते नहीं है। अगर स्पेसिफिकली अल्ट्रासाउंड केयूबी यानी किडनी यूरेटर ब्लैडर के कराते हैं तो
Okay.
उसमें आमतौर पे कर देते हैं।
ओके, तो उससे पता लग जाता है। और जो नॉर्मली बोलते हैं एनलार्जमेंट रहता है साइज का प्रोस्टेट का, तो डज इट हैज एनी रिलेशन?
साइज ऑफ द प्रोस्टेट इज द लीस्ट इम्पोर्टेंट क्राइटेरिया।
ओके,
सबसे इम्पोर्टेंट, अगर कोई किसी को प्रोस्टेट का प्रॉब्लम है तो उसका मैनेजमेंट के लिए सबसे इम्पोर्टेंट क्राइटेरिया है कि पेशेंट को यूरिनरी सिम्टम्स के लिए कितना डे टू डे फंक्शनिंग में इफेक्ट हो रहा है, बॉदरसम सिम्टम्स कितना है, क्वालिटी ऑफ लाइफ कितना इफेक्ट हो रहा है। उसके बाद आता है कि यूरिन इसके लिए प्रोस्टेटिक एनलार्जमेंट के लिए कोई एब्सोल्यूट कॉम्प्लिकेशंस हो रहे हैं क्या, जैसे ब्लैडर में स्टोन बन रहा,
राइट,
बार बार यूरिन में इन्फेक्शन होना, किडनीज में स्वेलिंग आना, या तो बहुत ज़्यादा पेशाब अंदर रुकना, खाली नहीं हो पा रहा है। ये सारी चीज़ें ज़्यादा इम्पोर्टेंट है बल्कि प्रोस्टेट का साइज से। कभी कभी एक 15-20 ग्राम का प्रोस्टेट इतना परेशान कर देता है, जो 100 ग्राम का प्रोस्टेट में पेशेंट चलते रहता है, कोई दिक्कत ही नहीं होती।
ओके, और जो नॉर्मल पीएसए टेस्ट होता है, डज दैट एनी रिलेशनशिप विद दैट?
पीएसए इज अ ब्लड टेस्ट which determines the health of the prostate.
राइट,
उसका पीएसए बढ़ जाने का कोई ऐसा कंक्लूजन नहीं होता है कि पीएसए बढ़ गया तो कैंसर ही है।
ओके, अच्छा, PSA is related with the cancer, not with urine flow and other things.
PSA is related with the normal age-related enlargement of the prostate,
Okay,
with prostatic infection as
Okay.
well as prostatic cancer.
okay. That means if someone has PSA within limits, so there are less chances of any cancer or.
Even with a normal PSA, there is a percentage of about 15 to 20% of patients may have prostate cancer.
Okay.
So it is very important to combine PSA examination with a rectal examination of the prostate.
Okay.
And these two complement each other in suggesting whether we should go for further evaluation.
Okay.
So if the PSA is high, or if there is an abnormal finding of a hard nodule on the prostate while on examination,
So that means we should get it done ultrasound also.
we should get ultrasound comes much before this.
Okay.
Then we have to decide whether we need to go for an MRI of the prostate and a biopsy of the prostate.
Okay.
To see if there is any cancer.
Okay. एक डॉक्टर साहब काफी पहले किसी एक डॉक्टर से बात हुई थी, was also urologist. He said कि आप 1 लीटर भी पानी पिए, मैंने ऐसे ही जनरल बात की कि लोगों को फ्रीक्वेंसी होती है, कई बार रात को उठते हैं, कई बार नहीं उठते हैं. He said 1 liter of water is sufficient, but with the age, normally other doctors say आप गेस्ट्रो के बात करेंगे या तो वो बात करेंगे आप खूब पानी पीजिए to keep yourself hydrated. So what exactly, where to optimize?
So the thing is, if someone is having a lot of frequency at night, his sleep is getting disturbed,
Okay.
then we would suggest that शाम के बाद 5-6 बजे के बाद पानी का इंटेक कम कर लीजिए, चाय कॉफी अवॉइड कीजिए, अल्कोहलिक ड्रिंक्स अवॉइड कीजिए, क्योंकि these are all fluids which increase the urine output.
Okay.
So you have to go very frequently. However, on the other, there's another condition of stone disease. In a patient who has had a history of stones in the urinary tract, it is said that the water intake should be such that in a 24-hour period, the urine output should be at least 1.5 liters to 2 liters. So accordingly, you titrate your fluid intake. So which may be about 3 to 3.5 liters.
Okay, so that 3.5 liters quite substantial. I mean, उतना फिर
Actually,
outflow भी ज़्यादा होगा.
Actually, if you see 3.5 liter, if you have one glass of water during the time that you're awake, so you say you're awake for about 15 hours,
Right.
you have one glass of water every hour,
Mhm.
then that itself comes to about 3.5 liters.
Okay.
At least if you have a 200 ml glass and you're having one glass every hour, spread out evenly throughout the day, that itself gives you 3.5
Suppose
liters.
someone is taking less, example आप दिन में 10 ग्लास लेते हैं या कितना लेते हैं, is it has got any
No,
negative effect?
it also
Does not
depends
matter.
on what sort of an environment you are.
Okay.
If you are more used to the more outdoor work in the daytime, then yes, of course, because of your perspiration, you're in a warm condition,
Right.
then the fluid intake has to be more. Otherwise, your urine will get very concentrated and you will start having stones in the urinary tract.
Right, right. डॉक्टर साहब ये जो आपने एक बताया कैफीन वगैरह का, चाय कॉफी का, बट नॉर्मल रूटीन में ही कई लोग तो बहुत ज्यादा कॉफी पीते हैं, चाय पीते हैं. Is it harmful for the prostate or this thing?
Coffee directly isn't harmful. Isn't directly harmful. It doesn't have a but it's just that the frequency of urination goes up.
Okay.
And because of the caffeine itself is a diuretic, it produces more urine.
Okay.
So that's why you may have to go more to pass urine.
Suppose someone is not going, रात को मुश्किल से एक बारी उठते हैं या 6-7 घंटे बाद उठते हैं, तो इज इट नॉर्मल? फिर तो कोई दिक्कत वाली बात नहीं, फिर तो कोई टेस्ट कराने की जरूरत नहीं.
See, the normal frequency of urination over a 24-hour period, if anyone is passing up to about 8 times in a 24-hour period, that is normal. Anything beyond that means that he has an increased frequency.
Okay. कई लोगों को मैंने देखा है जैसे सवेरे उठते ही 2-3 गिलास पानी पी लेते हैं, तो 2-3 बारी आपको मॉर्निंग में itself भी जाना पड़ता है.
So I do not recommend people to be having too much of water at one go.
Okay.
Though fluid intake जो है, that should be spread out and staggered throughout the day.
Mhm.
Too much of water at one go means that fine, you will get hydrated then, but then for the rest of the day, if you don't drink, you will again get dehydrated.
Okay.
It's better to have an optimal level of hydration.
At regular intervals, one should take water. And any foods or beverages you suggest for maintaining a good health of prostate, you should not take it.
No,
Lifestyle changes have to be there.
Lifestyle, as long as you're having a good balanced diet with good amount of fruits and vegetables, a low fat diet, low on meats.
Okay.
I mean, you don't have to become completely a vegetarian, but the meat content ideally should be white meat, either fish or chicken. Okay. Try avoiding red meat as much as possible.
Right. That's not good for heart point of view also.
So these are the small little things that can help in improving the quality of life as well as the lifestyle.
Okay.
And regular exercise is most important.
Any particular exercise which reduces?
Even if you go for your walks, an hour to 40 minutes walk every day in the evening or the morning, whatever time suits you. Okay. That's good enough.
It's good enough for maintaining it helps in optimizing your health of prostate also?
Not directly, but overall. Overall.
Right. Any specific suggestion you recommend for maintaining a good health of prostate?
There's hardly any exercise which helps in the prostate. But yes, if you do Kegels exercises to strengthen your pelvic muscles, that may give you a good control of your urination.
Squeezing your pelvic and
raising
it. Yes. Okay.
So that may help in your controlling of your urination if you have a sudden urge.
Okay.
So that will break that sudden urge and that will help you have a better control. That also helps in various sexual dysfunctions
Okay.
like premature ejaculation.
Mhm.
If you're having that, then Kegel's exercises do help in that also.
Okay. Some people I've seen, especially in winters. I mean, they get a lot of so much of pressure for immediately they have to
Yes.
rush to the washroom for passing the urination. So is it normal or is it?
See, that is again, since it is affecting the person's quality of life, he
Okay.
should seek consultation with a good urologist, and
Okay.
accordingly, they would give some lifestyle changes and some medication if required to get him comfortable.
So to conclude, in you say normally, I mean, related to urination, not necessary every routine you get it ultrasound or PSA 10 and other things, or it is once in a one year.
Once in a year is good to have.
It's good enough.
PSAs should be done once in a year.
Once in a year. Ultrasound also.
Preferably, a comprehensive urological checkup should be done once in a year, especially for anyone above 55, 60.
Okay, urological test, not
Yeah.
ultrasound.
Ultrasound, I mean, urological ultrasound. And,
Okay.
Uroflowmetry.
Okay. Okay. Any typical, any specific, I mean, say, whatever you say, from point of view prostate cancer, what are the immediate symptoms one should not ignore? I mean,
Early prostate cancer at times may not have any symptoms,
okay.
may be totally asymptomatic.
Mhm.
Otherwise, symptoms of a normal age-related prostate enlargement and prostate cancer in the early stages are more or less the same, like going frequently to pass urine, having a sense of incomplete voiding, need to strain to pass urine, going very frequently to pass urine. So these are the symptoms of prostatic enlargement, be it the non-cancerous or the cancerous. However, if the prostate cancer has spread out towards the bones, then they will be having pain in the bones, in the backbone, in the hips. So then those are all red flags where they should definitely seek evaluation. And any gentleman who has urinary symptoms should be seen by a urologist, and a thorough evaluation should be done, including a PSA and ultrasound, uroflowmetry.
Okay, so PSA is also indicator of that.
Yes.
Suppose someone has got high PSA, then one
Then
should
the-
get it thorough checkup.
Yes.
Any other points you would like to pass on to the society so that they can take care and for the good health of prostate and other things also?
Prostate is a normal walnut-sized gland.
Yeah.
As long as it is not causing problems,
Okay.
it doesn't need to be treated much.
Okay.
However, if there is a family history of cancer in the prostate,
Okay.
that is a very important point wherein the progeny should be evaluated.
Okay.
The siblings should be evaluated. The
Okay.
sons should be evaluated in the lines of prostate cancer.
This is also genetically
Yes,
related.
yes.
Right, Doctor. Thank you so much for
Thank you.
sparing your valuable time.
Thank you
Nice
very much.
meeting. Thank you so much. Thank you.